歡迎大家出席今日。
Welcome to the press briefing. With us today, we have Dr. Albert Au, Principal Medical and Health Officer from Communicable Disease Branch of Center for Health Protection, and Dr. Ray Lee, Chief Manager from Hospital Authority. Dr. Au will give us an update of cases. Friends from the media, fellow citizens, good afternoon. I'd like to report to you the latest information on COVID-19. As at yesterday, we had 105 positive cases, 25 confirmed by HA, 18 by Public Health Laboratory of Department of Health, the remaining 62 by private laboratories. Yesterday, we had 145 confirmed by RAT. Yesterday, we had a total of 250 positive cases. In the fifth wave, so far in Hong Kong, we have 1.19 million, 8,797 positive cases, 749,984 positive by PCR, and then 448,863 confirmed by RAT. For yesterday, 29 were imported cases. The remaining 221 were local cases. Among the imported cases, 13 were picked up at the temporary sample collection center at the airport and 11 during quarantine period in hotels. 2 on day 3, 2 on day 4, 7 on day 15, on day 5. Yesterday, we had a case, a sample taken on day 8 after leaving a quarantine hotel. We believe it was a positive case involving a 25-year-old female with 2 shots. She arrived from Hong Kong from the US on the 19th, and she stayed in the current quarantine hotel until the 25th, and her sample was positive on the 26th. CT value was over 30, and then we've got 3 positive cases picked up at CTC. We believe they were positive cases. There was a 34-year-old male with 3 shots. On the 13th of April, he was confirmed overseas with no symptoms. On the 14th of May, he arrived in Hong Kong, completed his quarantine on the 20th, and then the sample taken on the 22nd at CTC was positive with a high CT value. And then there is an 18-year-old male with 3 shots. On the 25th of March, he was positive when overseas. He had no symptoms. He arrived from India on the 14th of May, and then he completed his hotel quarantine on the 20th. On day 12, on the 15th, the sample was positive with a CT value of 36-37. Last, a 25-year-old female with 3 shots with no symptoms as well. She arrived on the 13th from Thailand. On the 20th, she completed her quarantine hotel. The sample taken on day 12 to 24th was positive by Public Health Laboratory, and the CT value was over 30. Last, involving a local member of cabin crew, he had 3 shots. On the 26th of May, he had symptoms. He lives in Sai Kung. On the 21st to the 23rd of May, because of work, he was in the U.S. According to what we know, he was on a closed route management when overseas. And on the 23rd, when he arrived in Hong Kong, his sample taken at the airport was negative at the airport, and on the 25th and 26th, his positive was negative. And then in the afternoon of the 26th, because he had symptoms, he did a test, and then it was positive. We considered an imported case, but then we will take a sample for PCR and genome analysis to see whether it could be a local case. For genome analysis, the Public Health Laboratory tested some samples. 138 was negative to L452R. 36 samples did not contain enough viral load. And for full genome analysis, there was some update yesterday. We said there were 4 cases of suspected BA.2.12.1. After full genome analysis, they are confirmed to be Omicron BA.2.12.1. The genome sequencing was identical to a McDonald's cluster. We announced a 36-month-old boy related to the McDonald cluster. Again, he's confirmed to be BA.2.12.1. In our full genome analysis yesterday, we found 2 imported cases where the genome sequencing was also identical. They both received quarantine in Marriott Hotel of Sha Tin. Their genome sequencing was identical, so we believe the 2 cases were linked. The sublineage was Omicron BA.2. The first was a 29-year-old arrived from Singapore on the 19th, and he had 3 shots with no symptoms. He was under quarantine in Marriott Hotel of Sha Tin. He lived in 2835, and the CT value was 2324 when the sample was taken on day 5 on the 24th. He was arranged to stay in a quarantine isolation hotel. Another case lived just next door, a 32-year-old male. He arrived on the 9th of May on the same day from Sweden and checked into this hotel. He had 3 shots. He had no symptoms. During quarantine in the hotel until the 15th of May. On the 15th of May, the sample taken on day 7 was positive with a CT value of 24 to 27. His accompanying was also positive. However, we could not do any genome analysis on his sample because the viral load was too low. Now, 2 groups were in the same hotel in between the 5th to the 14th of May. Now, because their rooms are adjacent to one another and their genome analysis is identical, so there might be some transmission in the hotel. So we've asked Buildings Department and MSD to do some inspection, and we will check CCTV record to see whether the 2 had left the room. For schools, today we received 18 newly reported cases involving 16 cases, 16 students and 2 teachers, all positive by RAT. 3 cases with samples taken yesterday, 15 taken early this morning. Of these 18, 7 primary schools were involved with 8 students and 1 teacher. One of the primary schools reported 2 students and 1 teacher to us. The 2 students were in the same class. There were 9 secondary schools involving 8 students and 1 teacher. The primary school I referred to was DSC International School. In the same class of this school yesterday, there was a case. So in one class of this school, 4 cases have been recorded, including 3 students and 1 teacher. There are over 500 students in this school and close to 100 teachers. All other students and teachers were negative this morning. In the class concerned, there are 23 students, so the remaining students are all negative. The first case displayed symptoms on the 24th and also tested positive by RAT. The last day he went to school was the 23rd, Monday. For the remaining 2 students and that teacher, they also attended school yesterday last. They had symptoms today and they tested positive by RAT. To play safe, we've suggested that this class should be suspended starting from the coming Monday. And then the students concerned should also carry out RAT over the weekend, and they should report positive cases to us and to the school, and their school should be thoroughly sterilized.
There was one death case yesterday so far. In the fifth wave, Hong Kong recorded 9,162 death cases. Death rate remained at 0.764%. Based on today's announcement of the 4 BA2.12.1 subvariant cases, one of them involved a family with 3 members affected. The first one to have been infected was a 63-year-old woman who actually was a cleaner at the Hong Kong Convention and Exhibition Center. Her last day of work was 23rd of May. And in the morning and around 8 p.m., he went to the staff canteen on the second floor of the HKCEC. We also found on yesterday a case in which involved someone who is a 55-year-old woman who also worked at HKCEC. She mainly worked on the third floor in the kitchen of a canteen serving people participating in exhibitions. She lived in Water Street, Lay-on Building. On May 24th, she began to have symptoms, and on May 25th, RAT tested positive. Her last day of work was May 23rd. Compared to the previous case, they did not know the other person who was infected, but she also from May 20th to 23rd in the morning, about 7:30 a.m., she had been to the same staff canteen for breakfast. And they also shared the changing room at HKCEC in the LG floor. So this latest case, since it tested positive in RAT test, there was no genome sequencing that was performed to see whether genome sequencing is the same as the other infection case. But we arranged for this case to have a PCR test conducted and do genome sequencing and see whether it's related to any cases infected with the BA.2.12.1 subvariant. And we've contacted the CDD and also engineering department to collect environmental samples from the HKCEC venues. Okay, now it's Dr. Larry Lee from Hospital Authority. Each hospital authority right now has 451 patients undergoing treatment. 59 are newly admitted, and those who need to be in isolation rooms, 87 are in isolation rooms, and 8 are in second-tier rooms. And 37 patients are receiving treatment at the North Lantau Hospital, Hong Kong Infection Control Center. So 24 of them are newly admitted. 2 patients are in critical condition, 1 in serious condition. And the 2 patients in critical condition, 1 was not vaccinated and 1 had 2 shots. So far, among patients undergoing treatment in hospital, there are 13 in critical condition and 9 in serious condition. 7 of the critical patients in critical conditions are receiving intensive care. 1 patient passed away yesterday, an 82-year-old man. She wasn't living in a residential care home for the elderly. She had 2 shots of BioNTech. She had chronic disease. So we thought that his condition might be related to cancer. On the 21st, through Princess Margaret Hospital, he was admitted into the A&E department because of vomiting and other health issues. He tested positive in PCR test, CD value of more than 30. And we found that his kidney function deteriorated, and we actually gave him proper treatment. On May 25th, he found that he lost consciousness. We tried to give him actually emergency medicine to help him recover, and yet by the 26th, by about 1 a.m., 26th of May, he passed away, and we found that his condition should not be directly related to COVID. In the past day, 54 patients have recovered, 39 of them have been discharged. In the 5th wave of the pandemic, so far, 50,570 patients have recovered, of which 49,497 have been discharged. So far, since 2020, 62,427 patients have recovered and 62,129 patients have been discharged. Now, we have not received any patients today who tested positive today. So far, 23,216 of our staff were infected. Of them, 23,172 have returned back to their job. So now it's time for Q&A. Please tell us which media outlet you're from. Hong Kong 01. I want to ask about the HKCEC case. The first case, where has she been, and where could she have been exposed to the subvariant of BA2.12.1? And she was a cleaner at HKCEC recently. There have been quite a number of exhibitions at HKCEC. Have she been to other floors or cleaned other areas in the convention center? And also in the places where people had meals, is those places close to other people from the outside or non-working members? As for the Canadian school, which had a cluster, I want to know among the students, how could the students could have been infected or have infected one another? Thank you for your question. On the first question about HKCEC, the cluster there, so far, staff who work there, we found that there are 2 cases discovered, and one was announced yesterday involving a cleaner. Our initial understanding is that she mainly worked on the 3rd floor of the HKCEC doing cleaning job, cleaning toilets, actually washing or actually wiping the lifts, buttons, and escalators and so forth, and she wouldn't have direct face-to-face contact with people participating in exhibitions. During her incubation period, we found that compared to the McDonald cluster, she didn't have any direct link with cases in the McDonald cluster. We're still investigating her source of infection. For the other case, well, she had the symptoms a bit later on the 24th. She also worked at HKCEC, but where they work differed. The latest case, she worked mainly in the kitchen, mainly doing washing dishes. What they had in common is that they had been to the staff canteen at HKCEC. So we think that the staff canteen, we know that the canteen is only open to HKCEC staff for meals in the morning, afternoon, lunchtime, and midnight snacks. Our information shows that there are about 600 staff at HKCEC, and all of them can use the staff canteen. But in that particular time slots, how many were eating there, we need to find out more. Yesterday, we announced the compulsory testing notice. Those who were there from 20 to 23rd, from 7 to 7:30 a.m., and also 11 to 11:30 a.m., those who have been to the canteen were required to do a RAT. Our investigation is ongoing, and so far we don't know whether the 2 cases are linked or what's the source of infection for the first case. Your other question about the Canadian International School, the outbreak there, so far within the same class at the school, there are 4 cases involving 3 students. The students with the who were the first to have symptoms went to school on the 23rd. The other 2 students and a teacher had their last day of school yesterday, and this morning they showed symptoms. And we know that within the classroom they were wearing masks. But this is a whole day school, so they would eat lunch at school, and the students would go to another classroom for lunch. And during their mealtime, even though they would remove their masks, but precautionary measures were followed, and they were only facing one direction, and there were partitions among the students, and there is also a proper distance between students. So we're still trying to figure out the teacher and the 2 students infected, whether they had contact with the first case. And we also carry out a genome sequencing of their specimens. Our initial understanding is that the family members or people they had contact with so far have not been infected, and neither are they linked to other cases or confirmed cases? So there could be possibility of transmission within the classroom. So we need to collect the environmental samples and carry out on-site investigation.
Next, the lady over there. Good afternoon. Well, you talked about a 63-year-old female who is a cleaner at HKCSE. She is responsible for cleaning washrooms and also escalators. So what is the risk of her spreading the disease to people who go to HKCEC for exhibitions? Now, recently, most clusters are on Hong Kong Island. Many of them carry the BA.2.12.1 sublineage. Would you say that there is a silent transmission chain on Hong Kong Island? Will mandatory testing notices or RAT be required? Which organization are you from? TVB. Our investigation shows that for the cleaner who works on HKCEC, she shows symptom on the 23rd. And then on the 21st and the 22nd of May, she reported duty. But then we understand that she was wearing mask when she went to work. So she would most likely be in contact with fellow workers, but all of them wore masks and she ate alone. So far, no close contacts have been identified, but we have asked her company to require all employees, including the about 10 fellow cleaners, and also her team, there are about 50 of them, to carry out RAT every day as well as PCR. So far, no new cases has been identified. As regards how she got the disease, we have to investigate. Preliminarily, we could not find any link with the previous McDonald's cluster. The only clue is there was a case living in Richlands Gardens on the 15th and 17th. She's been to Wan Chai, but then the places she visited did not have any direct overlap to places this case and also another cleaner have been to. And then on Hong Kong Island, we have seen clusters of Omicron BA.2.12.1. The source patients were the couple who live in Shau Kei Wan. They were picked up on day 12. And then they had moved around in Shau Kei Wan after onset. And then there is a relatively large cluster at McDonald's. So we believe the Omicron sublineage BA.2.12.1.2 is on Hong Kong Island. For the two new cases, they both work in Wan Chai. Our speculation is that this Omicron sublineage has found its way into the community by some silent transmission chains leading to some transmission. Now, for the two new cases in Wan Chai, we regard them as unlinked cases because we could not find any link, but their genome analysis show that their genome sequencing was identical to some previous cases, so they are linked. So we've already included some premises under the mandatory testing notices. So for members of the public who have been to these high-risk places, they should carry out compulsory testing as far as possible. The lady at the penultimate row. Now, I would like to ask about the DSC International School. I know it's on the ground floor of Poshan Mansion of Tai Kwu Shing. Could it be linked to the McDonald's cluster at City Plaza, leading to some kind of transmission in this school? And for the two males who live on the same floor of a quarantine hotel, do you think there's been some environmental contamination? Do you have to trace fellow guests on the same floor to prevent spread of the virus in the community? yes, the DSC International School is in Taikoo, and the 2 cases tested positive by RAT. We have to understand whether they have been to places patients carrying BA.2.12.1 have been to, but preliminary it's not confirmed that they have been to these places, but we have to investigate further. They tested positive by RAT. We will require swabs to be taken for PCR because we need swabs to do full genome sequencing. So we will have to check whether the lineage is BA.2.2.2 prevalent in society or BA.2.12.1. And we will see whether there are new cases from the same class or of this school or from other classes of this school. Now for the hotel, we have cases from 2 adjacent rooms. We believe the source patient would be the guest who stayed in room 2835, while both checked in on the 23rd, well, both on the 9th, but then the first patient who tested positive was the one living in room 2835, and then the patient who lived in 2833 was negative and only positive after 2 days. So there's no ruling out the possibility that they were infected in the hotel. One came from Singapore, the other from Sweden, and their genome sequencing was identical. So we'll ask EMSD to check the ventilation system and other areas of the hotel to see whether there are problems. We have seen this in Hong Kong before. You may recall that last year in other 2 hotels, there were a similar scenario. Air in a certain room entered another room through the corridor, and we'll ask CMSD to check whether ventilation system was problematic. Environmental swabs will also be taken. And then for guests who were on the same floor during the same period, they've all completed their quarantine, left the hotel, and returned to the community. They all conducted the test on day 12. We'll check whether the results were positive. We have not received any positive cases coming from the same floor of this hotel. During that period, there were about 10 guests. We will trace the findings of their samples taken on day 12. The lady in white. Good afternoon, I'm from Mingpao. Dr. Ao said that BA.2.12.1 there's transmission in society. For those living in one child, what advice do you have for them? Should they refrain from dining out? What can they do to prevent the spread of this chain? And for the 2 patients who work in HKCC, they both use the changing room on LG. How many staff members also use the same changing room? And for those cases unlinked, did they have any previous history of infection? And you said that are you talking about the strain BA.2.2 prevalent in Hong Kong, or is it another subvariant?
As for the situation in Wan Chai, well, yesterday, of the 4 cases yesterday, 3 involved a family, and the source of which should be the cleaner who worked at HKCEC. And there's another case who worked at the immigration department. And for these two cases, we couldn't find their source of infection. Well, they worked in Wenchai, and the places they have been to actually do not overlap with people in the McDonald cluster. So these cases are proven to be of BA 2.12.1. The source of infection is still unknown. And since they work in Wenchai, there could be some silent cases being spread, and it could have happened last week. So now we are closely monitoring the situation. If there are any new cases found, we'll carry out a genome sequencing to see whether they could be of the variant BA 2.12.1. Whether it is the Omicron 2.12.1 or the prevalent BA 2.2, the public must actually pay attention to personal hygiene and adopt precautionary measures when they're out or in contact with other people. They should wear masks properly and be vaccinated as soon as possible. The vaccines are proven to be effective in actually avoiding serious diseases or being fatal after being infected with Omicron. And once they are actually suffering from symptoms, they should do the PCR or RAT tests as soon as possible. We'll closely monitor the situation. If we found new BA 2.12.1 cases, then we will trace the case to see whether they are actually linked in any way to existing cases, or whether they actually involve people who work in the same district or have been to the same premises. So we still need to continue to monitor the situation in the coming 2 weeks. Your other question about the two cleaners who work at HKCEC. They go to the changing room on LG floor and they had lockers there. But the changing room actually can be used by all HKCEC staff. And when they use the venue, we know that they wear masks. And we also collected some environmental samples from the changing room to see if there are any virus there. The other question about the two cases who are of a BA.2 virus in the hotel, but that's different from the other BA 2.2 variant prevalent in Hong Kong. So these two cases, we treat them as imported. One came from Singapore. I'm sure the case was infected with a virus strain in abroad, and then they came to Hong Kong. Well, these two cases don't have any prior history of being infected with COVID. This one over here, cable. Just now you said that the 4 cases, the genome sequencing is the same of the cases in the McDonald cluster, and you said that if they are the same, that means that there is a transmission chain within the community. So could you gauge the impact on the community? Is there any need to tighten the social distancing measures? And also right now, Hong Kong's pandemic, cases, actually they still hover around 200. And Japan is going to open its border to tourists, including those from Hong Kong. So what do you think of the risk of Hong Kong people going to Japan? And would you allow those visitors coming back to Hong Kong to be quarantined at home? Thank you for your question. As I said, right now, we found a cluster or cases with unknown Omicron BA 2.12.1 virus. And it shows that in the community, there is the transmission of this subvariant. But so far, every day, Hong Kong has about 200 cases every day, and most of them are BA.2.2. And whether it's 2.2 or 2.12.1, they are actually the same group as Omicron. So they are actually virus strains that are similar, and there are various transmission chains, including the strain BA.2.2, which is common in the fifth wave, and also the newly emerged subvariant BA.2.12.1. But for these two virus subvariants, scientifically speaking, they, on the whole, actually, in terms of their, a reaction to antibody, they are similar in nature. So our preliminary information show that even based on local data, people who've been vaccinated, particularly those who have been infected with the BA.2.2 after vaccination, their body can actually generate very strong dose of antibody or immunity against BA.2 Omicron, including the new subvariants of Omicron. And so far, we haven't got any concrete scientific evidence showing that BA.2.12.1, this subvariant, would actually lead to hospitalization or result in serious symptoms. That is increasing the chance of those happening. Therefore, the public need not be too worried. That is, whether what is prevalent now is BA.2.2 or the new subvariant 2.12.1, because we have the same precaution anyway. The most important is for everyone to be vaccinated as soon as possible, because that can be an effective prevention against serious diseases resulting from infection. And personal hygiene is important. The Hong Kong pandemic situation now is at a rather stable stage. The daily figures is about 250. We saw a downward trend earlier on, and we still need to closely monitor the days ahead and to see whether the case number will come down. But because of the relaxation of the social distancing measures, the chances of transmission in the community has increased. And the case numbers now have remained at a certain level, and we will closely monitor and see what the trend is in the days ahead. As for home quarantine, you are talking about people returning from abroad, right? Right now, we have very stringent policy to avoid imported cases because we are concerned about whether overseas subvariants that actually are different or newly emerged subvariants, different from the variant prevalent in Hong Kong coming here. So therefore, we are adopting very stringent measures against bringing imported cases. So based on our risk assessment, people traveling from overseas to Hong Kong needs to be quarantined at home and undergo daily tests, so that if there are imported cases, we can detect them as soon as possible and avoid them from being spread to the community, and we can also know whether there are new subvariants or various strains coming in. Last question. I want to ask about the Canadian International School cluster of the new cases today. The students in the classroom, were they sitting next to each other? And also the first student with symptoms, is he the first case? And how would you collect the environmental samples, or where in the school would you collect the environmental samples? And there's a 44-year-old air cargo crew member who's infected. Have you studied his itinerary, where he had been to? Had he been to any restaurants or public places? And also the Marriott Courtyard Hotel cases, you said that people on the same floor have been quarantined, but now there's a cluster at that hotel. So people who finish quarantine, would they need to be re-quarantined again? And also for the spread of the subvariant in the community, as you said that the variant could be even more contagious. Are you suspecting any large-scale outbreak in the community again? And also the people who recovered from BA.2.2, would they be reinfected again? For the Canadian International School cluster, our understanding is that 3 students, actually, 2 of them were sitting very close to each other, and the others sat a bit far from them. But still, because there are only 23 students in the classroom, and they had activities together, and they may not, they did not sit, permanently in one sit, and therefore they may move around in the classroom. Looking at their sitting plan, 2 of the students infected were pretty close to each other. And one of them, actually, last day of school was Monday, and he had the symptoms the earliest, and the other 2 students affected only showed symptoms today. So there's a gap of 4 days of difference. So these 2 students might have been infected by the first student, the first one to have the onset of disease. So that could be the possible scenario, because these students, their family members, were not linked to any cases. And I would not rule out the possibility that maybe some class activities that made the students have face-to-face contact with one another. The teacher on Monday and Thursday taught this class. When she had class on Monday, there's a chance that she could have been in contact with the first case. And we ultimately have to look at the genome sequencing and see whether the 4 cases have the same genome sequence, and which, if that's the case, which will show that there's a small-scale transmission within the classroom. And we will collect environmental samples from desks or air purifiers, ventilation machines, places that actually are usually normally touched by people in the classroom.
The second question relates to the member of crew. He is an air cargo cabin crew member. When he come back to Hong Kong, he followed the requirements of the CHP RAT done every day, and he hasn't been to any eatery when in Hong Kong, but we have to check again. Now, it's not that this hotel really has got a cluster. We've only found 2 cases living in adjacent rooms on the same floor. So that's the possibility that one guest passed it to another guest. Now, no other cases were found during the period, because when people are under quarantine, they have to conduct RAT every day. On day 5, a PCR, and day 12, a mandatory PCR in the community. We have not picked up any other case staying on the same floor during the same period on the same side. So we will check the PCR records of all guests staying on the same floor. Regarding the risk of BA Omicron, BA 2.2.2.1, although WHO has announced that this sublineage may be more transmissible than other sublineage of Omicron, but compared to BA.2 or BA.2.2, the prevalent lineage in Hong Kong, now this is other sublineage. Hong Kong has just been through a very serious 5th wave, and many members of the public have been affected, and they have immunity or antibodies. So far, we believe they are able to protect themselves from BA.2.2.2.1. And if another shot of vaccine is taken after infection, then the antigens level can be boosted. We have data from Hong Kong U and CU to support this. Their experiment found that antigens formed after injection or infection will be able to protect people from BA.2. And so far, there's no scientific data to say that after being infected with BA.2.2, a patient can be infected by a new sublineage. Natural immunity developed after infection will dwindle with time. So after a few months, the immunity may be gone. So may I appeal to members of the public, if you are a recovered patient, you should receive the right dose of infection. About 1 month after recovery, you are ready for a shot. So if you take a shot of vaccine after infection, then you can protect yourselves against another round of infection. The PB ends here.